Hello, I'm Dr. Ramsey, Amin. The topic today is alcohol and dental implants. There's a great majority of people who drink alcohol. Some do it in moderation, some do it very heavily. It's going to affect your dental implant surgery for sure. So let's talk about how it affects it. In fact, it's going to affect all types of surgery that you have done, whether it's in your mouth or on your back or in your gut. So one of the things that alcohol does, just in general, if you think about a pregnant woman avoiding alcohol, is it's going to kind of suppress making cells, right? So it doesn't. It can cause birth defects, right? So it can really change the way that the bone is healing. So we rely, especially in the first 6 weeks or even 3 to 4 weeks of the implant being put into the bone or the bone being built from a dental implant bone graft, that there's a lot of things that your body has to do and everything has to happen just right for you to form bone, either as a bone graft or form bone around an implant, whether it's a zygomatic implant, a pterygoid implant, a regular dental implant. It doesn't matter, but so many things have to go right, just like a baby being born. There are so many things that have to go right for there to not be any, let's say, birth defects, correct? So avoiding alcohol, especially in the few days prior and 3 to 6 weeks afterwards, I would really say to 6 weeks, it's really critical. Besides during the surgery, it increases your bleeding. If you drink a lot, and a lot is sometimes considered, a couple beers a night, right? A glass of wine, a couple beers a night, that makes you bleed. Our liver makes the components that make our blood clot, and in general, people happen to have higher liver enzymes. They're called ALT, AST, and that makes us bleed. It can make for a really messy surgery. It can put a lot of stress on the surgical team, and you bleed a lot afterwards, and it's kind of like driving in the fog. I've done many procedures that are very, very bloody, and alcohol was oftentimes one of the reasons that cause it. But and the other issue is that alcohol interferes with medications, right? You're probably going to be on an antibiotic after having a dental implant surgery, whether it's full mouth or a single one. Dental antibiotics are oftentimes needed. Sedation medications, obviously we're either putting it out or moderately sedated for these types of procedures. So alcohol also is not great for that. Alcohol goes hand in hand with smoking. I've got another blog video on smoking as well. And the saying with smoking is you can either smoke or you can have teeth, but you can't have both. So many people smoke and drink and have often lost their teeth to periodontal disease. Alcohol is also what they call empty calories, and tends to lead to patients that have increased blood glucose or pre-diabetic, diabetic, or maybe you don't even know that you're diabetic. In my office, we test you for that, especially if you haven't been to a doctor for a while. We'll test something called A1C and blood glucose levels to possibly see if you have any issues with diabetes. But alcohol can be used during dental implant healing. I don't want to take away all fun, but it needs to be reduced, especially if you have a problem with alcohol, then maybe this isn't the right time to have these procedures done, right? Maybe we've got to work on, some self-reflection and work on ourselves, quitting smoking, reducing or quitting alcohol altogether. But it definitely slows down healing tremendously. And it's one of the reasons that I try to always, talk to patients about these things. It is a part of life, especially around the holidays. Patients ask me, they've gone through surgery, hey, when can I, go to the holiday party, when can I start drinking? Yeah, just a little bit. You don't need to have a lot. Everything in very moderation or very light in the first 4 to 6 weeks after the dental implant surgery. But bottom line is alcohol does inhibit the healing of dental implants and bone grafting, causes some safety issues with bleeding, safety issues with anesthesia, and you just want a good result. I want you to have a good result regardless of who's treating you, and so that this all works out. All right, this is Dr. Ramsey, Amin, BurbankDentalImplants.com. Leave some questions down below. We'll talk about it, your unique situations, and of course, if there's a problem with alcoholism, that's something you obviously want to seek help for. And you may find that the implants don't work at all. I've had some patients that drink so heavily that just nothing really worked. Oftentimes the lifestyle that comes with heavy alcohol use lends itself to habits that aren't so healthy. So I'll leave it at that. Thank you so much. I'll see you soon. Bye.